Food insecurity is a growing crisis affecting thousands of families on Long Island. Many struggle to put meals on the table, unaware of the resources available to help. At the Health and Welfare Council of Long Island, we are committed to ensuring that families can access nutritious food through the Supplemental Nutrition Assistance Program, or SNAP. In this episode, we'll break down the facts, debunk the common myths, and show you how to get the help you need.
Hi, I'm Jasmine Brown. I am the Client Services Manager at the Health and Welfare Council of Long Island. Food insecurity definitely can affect anyone, but I do think that there are more vulnerable families or vulnerable people that are affected by food insecurity. That's definitely senior citizens or even disabled individuals who have to live on a fixed income, or students who are in college and they have to pay their tuitions, but they also need to eat, and they might live alone or out of their households with their families. That's definitely working class citizens who meet right above the income line so that they are cut off from SNAP benefits, but they can't afford, food, but they have other expenses. That's also veterans. We have a lot of veteran communities on Long Island, and they not always can have access to the same things that everybody else does. So they are also vulnerable when it comes to food insecurity as well. SNAP is the Supplemental Nutrition Assistance Program. It is a program to assist individuals who qualify with supplementing their food cost. There are a lot of myths about SNAP, and I think that they deter people from applying for the benefit even though they really need it. One is definitely that SNAP is for unemployed individuals. It's not something that's just for individuals who are unemployed. It's for anyone who can qualify. We do see a lot of individuals who are working, but they just don't make enough. Their incomes don't supplement them enough to be able to buy food. So that's definitely a misconception that I think a lot of people deter themselves from applying because they might have a job, but they think that they should be making enough. I also think that a myth that when you have SNAP, you failed. That's definitely not something I think people should believe or internalize. SNAP is supposed to help you. Doesn't matter, what you're going through, but it is there designed to assist you through what you are experiencing so that you can put food on the table. Another myth is that immigrants should not apply for SNAP. There are definitely criteria that they might have to meet, but it doesn't mean that they shouldn't at least try to apply for the benefit. If you're hesitant about reaching out for assistance with applying for SNAP benefits, I would encourage you to apply. You'll be met with compassion, but also someone to hold your hand through the entire process of the application process. And we won't judge you. We'll assist you and ensure that you have the help that you need to get the benefit. So that is completing a full pre-screen in the beginning to ensure that you are eligible for the benefit, and then also helping you to submit the application and communicating with Department of Social Services, either on your behalf or with you, so that you're not alone to get the benefit. There are a lot of different challenges that someone might face when applying for SNAP benefits. One is document submittal. A lot of times people don't have access to the required documents, so that could be proof of their income or pay stubs that are current, or even just proof of their residence, because we do have a lot of clients who are immigrant status, so they have to have access to different documents that are required for the benefit. So that's been something that we've seen as a barrier for sure. Also, just being denied when you're actually someone who qualifies for the benefit. That deters a lot of our clients from reapplying or even trying in general, because they might have heard through word of mouth that it's hard or that the process is difficult. So we try at HWCLI to assist and make sure that we can navigate those things with our clients, but it is something that we've faced. I think part of what my team does to get through the barriers is encouragement, honestly. Encouraging the clients to continue to be steadfast, that one, we've screened them, we've done a budget modification, or we've done a budget examination to see how much they might even get, what the allotment might be. So encouraging them in that way, and then just listening to them through the process. Sometimes it requires us to educate the clients in the beginning. So when you come to us, you're not just going to get pre-screened, you're also going to be educated on what the process is going to look like. So I think that when you know that there's going to be a potential for you to have a lot of different documents be required or asked of you, then you'll know in advance and it'll be a little easier for you to go through the process. At HWCLI, the entire team is bilingual with English and Spanish. However, we do use a translation service to make sure that we have language access to anyone who comes to our doors. So we will get on the phone with you, we'll get on the phone with a translator and ensure that you feel comfortable through the process, but also so that you understand, because language can be a barrier. If English is not your first language, it could be difficult for you to navigate the application process. So we do try to make sure that whoever comes is not only comfortable, but also met with someone who's going to speak their language. At the Health and Welfare Council of Long Island, we know that it's not just food that a lot of people are in need of, so we partner with a lot of different organizations. One, we meet clients where they are, so we attend a lot of community events. So that is events that happen at schools or community fairs or health fairs, because we know that they're already going to be frequented with a lot of community members that might need other services, so they probably also need SNAP assistance as well. And we'll partner with them to make sure that the clients are not just getting SNAP benefits from us, but other services as well. So we'll refer. So if we want to refer to our healthcare team at HWCLI, we'll make that referral, make a warm handoff so that the clients also feel comfortable meeting with us and working with someone else on a different team. But also we partner with other nutrition programs like WIC offices, as well as food pantries, so that we can make sure that emergency needs are met as well. On average, a SNAP process can take up to a month. Once you submit the application, you do have to wait for the Department of Social Services to review your application. With that process, they might ask for additional documents or ask you to do an interview where they ask you questions to essentially prove what you've put in your application. By law, they do have 30 days to get back to you with an approval or a denial. If we screen someone and we believe that they are qualified, but they're met with a denial from DSS, we will go with them through the process of trying to not only investigate, but reapply if needed. Or they can go through the appeal process with DSS, which is essentially presenting their case. We definitely allow the clients to make the decision on their own, but we encourage them to reapply if we've done the assessment and have determined that they would be eligible for the benefit. This looks like assisting them with submitting new documents. This looks like also communicating with the local DSS to advocate on their behalf. This is also just explaining to the clients what the denial means and why they may have gotten that, but also just really encouraging the client to continue through the process so that they can get the benefit. HWCLI partners a lot with a lot of different organizations. One is definitely WIC. It's also a nutrition-based program, so we will refer clients to that. We'll also refer to food pantries so that you can get emergency assistance. We also partner with a lot of different food pantries like Island Harvest and Long Island Cares, two big conglomerates on Long Island that assist with emergency food supports. Food insecurity is not just a one-shop deal, and SNAP definitely assists, but there are other things and other programs that might help our clients, so we make sure that they have the information that they need. We're fighting for hands-off SNAP. We don't want there to be any cuts for SNAP. We also don't want there to be any cuts for universal free school meals, which is something that the governor just put in her budget, which was the first time that we've seen anything like that. So we were really happy about that. But now those things are being under attack. We're also advocating for students. It's extremely hard for students to get SNAP benefits. So through our advocacy, but also just our work with students, we're learning a lot more on what to say and what to communicate to legislation so that we can advocate for these vulnerable groups. Once you've applied for SNAP benefits, you typically have to wait 30 days for an approval. Once approved, you will get in the mail your EBT card that you have to activate. This is basically like a debit card used just for your groceries. Then you can go to any grocery store, any participating store that has usually in the window a sign that says SNAP or EBT accepted here, and then you can buy whatever you need for your family. The Health and Welfare Council of Long Island goes the extra mile. We will hold your hand through the process. We make sure that you have access to different languages. If we don't speak it, we'll make sure that we find someone who does. We also make sure that you understand exactly what's going on, what to anticipate, what the documents are required for, why we need certain things from you. We just make sure that you understand fully and you're educated on the process so that we can help you get the benefit. The Health and Welfare Council of Long Island SNAP team is in the community. We're meeting you exactly where you're at. We're at the library, we're at the clinic, we're at the church, we're all across Long Island. We're also in Queens. So we service Suffolk, Nassau, and Queens. You can call us and we can do the service over the phone. We can meet with you virtually. We can do the whole application online as well with you over the phone. But if you need to meet with us in person, there's a number of different places you can get access to us at. We're here to help.